This lecture will provide you with a summary and overview of the Patient Protection and Affordable Care Act. We will be discussing many of the specific provisions of the Act in lectures and discussion boards, and how these provisions have been implemented. Your final assignment for this course is an analysis of one component of the ACA. The editors of the Nickman and Kovner text have provided an ACA supplement that you should read. However, some of this material may now be out of date. Millions of people in the United States do not have health insurance. Although those 65 and older are covered by Medicare and many non-elderly receive their health insurance as a job benefit, not everyone has access or can afford this type of coverage. Medicaid and the Children's Health Insurance Program, or CHIP, also known as S-CHIP, or the State Children's Health Insurance Program, have filled the gaps in coverage primarily for low-income women and children. Being uninsured affects people's access to needed medical care and their financial security. A major goal of the Affordable Care Act, which was passed in 2010, was to expand coverage to millions of Americans who were previously uninsured. The ACA has filled some existing gaps in coverage by providing for an expansion of Medicaid for adults in states that chose to expand, building on employer-based coverage and providing premium tax credits to make private insurance more affordable for many with incomes between 100 to 400% of poverty. The Patient Protection and Affordable Care Act is probably the most important event of the Obama presidency and has affected the future of healthcare in the United States. The PPACA is made up of the Affordable Health Care for America Act, the Patient Protection Act, and healthcare-related sections of the Healthcare and Education Reconciliation Act, and the Student Aid and Fiscal Responsibility Act. It also includes amendments to other laws like the Food, Drug, and Cosmetics Act and the Health and Public Services Act. The additional rules and regulations that resulted from this law have also expanded the law. The ACA attempted to reform the healthcare system by providing Americans with affordable, quality health insurance and curbing the growth in healthcare spending. Title I of the ACA includes the insurance exchanges, cost assistance, rules for business, and mandates. Provisions in the first title provide for the elimination of annual and lifetime dollar limits by health insurance companies. This title also established essential healthcare benefits, prohibited your insurance company from dropping your coverage, prohibits an insurance company from denying you coverage due to a pre-existing condition, and also prohibits higher premiums based on your health status. The title requires insurance companies to cover preventive services and immunizations with no out-of-pocket cost and allows dependent children to stay on their parents' plan until they are 26 years old. Another provision establishes uniform coverage documents so consumers can make comparisons of benefits between different insurance plans. Insurance companies are also limited to spending no more than 80% of premium dollars on non-medical costs, or the beneficiaries get a rebate. The provision for minimum essential coverage is a mandate for large businesses to cover full-time workers, and insurance companies cannot charge higher premiums based on health status, gender, or salary. Title II of the ACA extends Medicaid, preserves the Children's Health Insurance Program, and simplifies Medicaid enrollment. It improves community-based care for disabled Americans and provides states the opportunity to expand home care services. Title III closes the coverage gap or donut hole in Part D Medicare and provides incentives to healthcare institutions and professionals to improve care. Title III also has provisions to protect Medicare. Title IV promotes prevention, wellness, and public health with dedicated funding through the Public Health Prevention Fund, and also requires the provision of nutrition information by large chain restaurants. Title IV also waives co-payments for preventive services and adds many preventive services for women. Title V funds scholarships and loan repayment programs for students in health-related professions and helps fund and expand community health centers. Title VI focuses on keeping Americans informed about health care. This includes greater transparency in nursing homes with regulations and incentive programs for quality control. The Act provides measures to identify providers who have committed fraud. Title VII promotes medication price competition and innovation, extending drug discounts and supporting creation of generic versions of biologic drugs. Title VIII provides Americans with a new option to finance long-term services and care in the event of disability, but this title was repealed in January of 2013. Title IX improves tax enforcement and the closure of tax loopholes. Title IX also provides new tax credits on premiums. Title X reauthorizes the Indian Healthcare Improvement Act, which provides healthcare services to American Indians and Alaskan Natives, modernizing the Indian healthcare system. As you can see, there's a lot more to this act than Medicaid expansion and insurance exchanges. The New England Journal of Medicine published an article in June of 2015 about the status of the ACA at 5 years. The clearest and most measurable effects of this were related to the availability of health insurance to the American people and their access to care. Estimates of the numbers of uninsured persons who have gained coverage since 2010 range from 7 to 16 million. A major change to the ACA is to repeal the tax penalty for not purchasing insurance, which takes effect in 2019. This does not repeal the individual mandate, but takes the teeth out of it. There are still employer mandates, although there are more exceptions. Provisions such as the Cadillac tax on generous employer policies, the medical device tax, and the health insurer tax have been delayed. The federal insurance marketplace continues to provide insurance for individuals, and many states continue to provide health insurance marketplaces. However, due to increases in premiums, many individuals cannot afford insurance who aren't eligible for financial assistance. The status of the ACA is in a state of flux, so it is difficult to determine what the final impact will be.